The Portrait War. A subtle, calculated act of erasure just occurred in the halls of the Department of Health and Human Services, sparking a national controversy. The nameplate on the portrait of Admiral Rachel Levine, the first openly transgender four-star officer, was covertly replaced, removing her legal name. The HHS defense. They claimed the change was necessary to ensure all information reflects gold standard science and biological reality. This video is not about politics. It is about taking the HHS at their word and applying the evidence edge to the scientific data behind the policies Admiral Levine championed, which are now being reversed. Admiral Levine's policy focused the stakes. Admiral Levine's 4-year tenure as Assistant Secretary for Health was centered on health equity. Her work focused on several evidence-based priorities, leading the U.S. Public Health Service, combating the opioid crisis, addressing the syphilis surge, and crucially, expanding access to care for the LGBTQI+ community. Her policy was to ensure that health equity was integrated into every HHS mission, believing that a vulnerable population affects the health of all Americans. The Gold Standard Challenge. The claim that the current administration is simply upholding gold standard science to reverse harmful policies is what we must test. When politics challenges medical consensus, the data must speak. We are going to analyze the evidence for the specific, highly contentious policy Levine advocated for: gender-affirming care. Is the consensus gold standard, or is it, as critics claim, unsupported ideology? Policy 1. Gender-affirming care, the consensus. Levine repeatedly stated that there is no argument among medical professionals about the value and importance of gender-affirming care. The gold standard evidence she referred to comes from major professional medical organizations: the American Academy of Pediatrics (OB), the American Medical Association (AMA), and the Endocrine Society. These groups uniformly classify gender-affirming care GAC as medically necessary, safe, and effective for those experiencing gender dysphoria. This is based on decades of accumulated clinical evidence showing that GAC leads to lower rates of depression, suicide, and psychological distress in those who need it. The scientific nuance, the risk argument. The counter-argument, often cited by politicians and some dissenting medical groups, is that research on long-term outcomes, especially for youth, is weak and that the procedures carry permanent risks. This is where the evidence becomes nuanced, requiring careful distinction between clinical consensus and longitudinal population data. However, the international scientific consensus supports GAC as the initial treatment pathway, citing the immediate risk of severe mental health crises in its absence. Policy 2. The opioid crisis data-driven. On the opioid epidemic, a less contested area, Levine's policies were entirely data-driven. As Pennsylvania's Secretary of Health, she expanded access to naloxone, the overdose reversal drug, and successfully lobbied for medication-assisted treatment MAT for opioid use disorder. MAT, using drugs like buprenorphine and methadone, is the proven gold standard treatment with overwhelming evidence showing it reduces the risk of relapse, overdose, and mortality by up to 50%. This is a clear case where her policy followed the strongest possible scientific evidence. Policy 3. HIV. STI prevention evidence reversal. Levine also led the fight to end the HIV epidemic, promoting the use of PrEP pre-exposure prophylaxis and the UU and detectable equals untransmittable message. PrEP is a near 100% effective tool for preventing HIV transmission. Alarmingly, the current HHS administration has been criticized for rolling back inclusive, data-driven policies on HIV, STI prevention, and removing critical SOGI sexual orientation and gender identity data collection, the essential tool for tracking these epidemics. The science of health equity. Levine's core principle, health equity, is supported by the broadest scientific evidence, the social determinants of health SDOH. Decades of research show that marginalized groups, whether based on race, income, or gender identity, face systemic barriers that lead to chronic stress, poor health care access, and her policies were designed to mitigate these SDOH, a widely accepted gold standard concept in modern public health. Therefore, using gold standard science to justify attacks on these equity initiatives fundamentally misunderstands the comprehensive evidence base. The weaponization of biological reality. The HHS defense mentioned advancing biological reality. As scientists, we know reality is complex. While human sex is chromosomally determined XXXY, gender identity is a complex neurological and social phenomenon. The evidence supporting the biological basis of gender identity is rapidly expanding, and denying transgender identity as a valid reality in healthcare leads to worse outcomes. The scientific gold standard of public health is to treat the patient's condition, not police their identity. The evidence edge takeaway. The battle over Admiral Levine's portrait isn't about the portrait itself. It's a proxy war over which science and which population the federal government chooses to prioritize. The science behind her policies on MAT and HIV prevention is definitive. The science supporting health equity as a necessity is irrefutable, and the consensus supporting gender-affirming care is backed by the largest medical bodies in the world. The evidence edge demands that policy be driven by the best available data, not by political grievance, conclusion, and CTA. We must hold all administrations to the highest standard of scientific integrity. Subscribe to the Evidence Edge now to ensure you receive clear, evidence-based analysis that cuts through the noise. And to learn the science behind true longevity and health, click here to watch our definitive guide, 45-Minute Cellular Reset, the Autophagy Protocol.